Hello, everyone, and welcome to our webinar this afternoon. Thanks so much for joining us. This webinar is a partnership between the Community Health Nurses Initiatives Group, known as CHNIG, of the Registered Nurses Association of Ontario, and the National Collaborating Centre for Methods and Tools, also known as NCCMT. My name is Emily Belita, and I'm lucky enough to be representing both of our partner groups this afternoon as co-lead of Research Education and Professional Development of CHNIG, and as a Knowledge Translation Advisor of the NCCMT. We also have with us behind the scenes Vandana Dhaliwal, providing technical support. Thanks so much, Vandana. And our speaker, Emily Clark, who I will be introducing in a moment. So our webinar this afternoon will be focused on evidence-informed decision-making in the era of COVID-19, which of course is an incredibly relevant topic given our current climate. I was reading a journal article the other day in which authors had conducted a bibliographic analysis of two major online databases, Web of Science and Scopus, and they had found that there were 23,000 documents related to COVID-19 just between January 1st and June 30th. So there's a tremendous volume of research that's being produced and disseminated, and that really speaks to the importance of ensuring that the best available evidence is integrated into the various decisions being made that impact policy and practice around COVID-19. And with that, I'm really pleased to introduce our speaker for this afternoon's webinar, Emily Clark, who's a knowledge broker with the NCCMT. Emily has earned 2 Master of Science degrees, one in biology from McGill University and a second in health research methodology from McMaster University. Emily brings her expertise in project management, writing, and teaching to her role as knowledge broker with the NCCMT's clients to implement evidence-informed decision-making in their own organizations. Her diverse portfolio includes developing and refining the NCCMT suite of products and services, networking and outreach to various audiences, and leading and supporting a range of knowledge translation projects. So I'll pass it on now to Emily.
And of course, despite months of this pandemic, I managed to not unmute my mic as I get started. So huge thank you to Emily Belita for the introduction, as well as for the connection with CHNIG in order to do this webinar. I was really excited when we had this topic brought to us. This is a presentation that we give fairly frequently on EIDM and on NCCMT, but to actually integrate what we've learned about COVID in the last or dealing with evidence during the COVID pandemic in the last, 10 months now, is really exciting. So I'm really glad to be able to share that with you. Before we jump into the webinar content, we do have a couple of housekeeping items. We do recommend, if possible, using a wired internet connection. For best results, the latest version of Google Chrome or Firefox internet browsers will work best. And if you do have any technical difficulties, please send a private message to our support team, Vandana Dhaliwal. She's available for chat under National Collaborating Centre for Methods and Tools, and she will be able to respond to any requests that you have. This is a brand new webinar platform for us called Big Marker. I think this is the second public webinar that we've done with this one, so very excited to be using it, and I think we've worked out pretty much all the kinks, so bear with us if there are any, but I think we're in pretty good shape. If you do have any questions for myself or for Emily Belita throughout the webinar, please post them in the public chat, and we'll make sure that we get to those. If I'm able to put my attention to it, I'll answer them as we go. Otherwise, we'll make sure that we save them at the end of the webinar. Vandana will be keeping track to make sure that we don't miss anything. We do have a couple of polling questions today during the webinar. When they open, they will pop up over the slide. There's sometimes a very short delay in the question popping up. Once you enter your response, make sure that you hit submit so that it's recorded. You can also select to do it later, and it'll go to your open queue and can be completed at any time during the webinar, as is shown in the screenshot on your screen. After today's webinar, we will post the recording in English at our YouTube channel, as well as all of the slides in both English and French on our SlideShare. The links are posted on the screen, and I believe will also be posted in the chat window so that you can bookmark those for later. So we'll start with our first polling question for today. What we're interested in today is how many people are watching today's session with you. This is a question that we ask usually to know. There were times in the past when staff at different organizations would attend webinars together. We recognize that I'm sure many of us in the audience are working from home and likely alone at this point, but we are interested to see how many people are really with us today. So make sure that you select your response and hit submit. And I remember last time I was able to see the results. And oh, I can see the results. Yep. So it looks like 97% are attending alone, and we've got one group of 2 or 3. So that's fantastic. For our second polling question, this will pop up on your screen as well. We're interested in knowing how familiar are you with the NCCMT? Have you visited the website before or used our resources? Especially as we have, I think, a number of audience members that we have from CHNIG. We're interested to see if this is one of your first times interacting with NCCMT or if you've used some of our resources before. I see the responses coming in now. Looks like most, or about 50-50 actually, in terms of people who are more familiar with us and some people who are new to the NCCMT. So during this webinar, we will go over a number of resources that we have that may be useful to you in your practice, and I look forward to hopefully hearing about which ones may be useful for you. Our third polling question and the last one for right now, if you did answer yes to the previous question, we're wondering just how often have you been using the NCCMT's resources, whether you've interacted with our site and our resources once, a couple of times, or more often than that. So please just indicate your answer there for those of you who had answered yes on the previous question. This really does help us get an idea of who's in our audience so that we can tailor this webinar as well as future webinars to make sure that we are providing the most useful content that we can. So it looks like a lot of people are falling into that 2 to 3 times category, so that's fantastic, and we're hoping that we can point out some of the resources today and get you back again soon. So jumping into then what we are doing with this webinar today. So first of all, welcome to the members of CHNIG. Very excited to be doing this webinar for you. And then anybody who was not part of CHNIG. We realized that this webinar would be open or would be important for a broad audience. So we opened up registration to anyone and everyone. So very, very glad to have a pretty good size audience today. What we would like to cover today is an introduction to the NCCMT and the larger NCCPH. What is evidence-informed public health? What do we mean when we say that? What does that process actually look like? What are the steps in the process, and how can you ensure that you are taking an evidence-informed approach? And then I've now adapted this presentation to how has our approach changed during the COVID-19 pandemic. I'll talk a little bit about what we have done to support public health during the pandemic and some of the lessons that we have learned along the way. So again, I think I mentioned this is a presentation that I've given, many times, overview of NCCMT, what is EIPH, and then really exciting to actually bring in what we have learned over the past almost a year now in terms of the pandemic and how to use EIPH in the current evidence climate. So jumping in, the NCCPH is a group of 6 national collaborating centers across Canada. It stands for National Collaborating Centers for Public Health. The NCCMT, so National Collaborating Center for Methods and Tools, is one of these 6 collaborating centers. We specifically are hosted at McMaster University in Hamilton, Ontario. Our goal is to support public health professionals and organizations to integrate evidence-informed decision-making into all of our work. The NCCs as a whole, the group of 6, are funded by the Public Health Agency of Canada. And we each focus on different priority topic areas within public health. So starting out west, we have the National Collaborating Center for Indigenous Health. They're located in Prince George, BC. The NCC for Environmental Health is in Vancouver. The NCC for Infectious Diseases is in Winnipeg. The NCC for Healthy Public Policy is in Montreal. And the NCC for Determinants of Health is located in Antigonish, Nova Scotia. If you are unfamiliar with these other NCCs, I do encourage you to take a look at their websites. They have some really fantastic resources available in different formats. Some run, webinars, podcasts, and have many different resources that are useful in everyday public health practice, as well as during COVID. So specifically at the National Collaborating Center for Methods and Tools, our focus is on championing the use of evidence in public health decision-making. We do this through a number of different strategies by curating the latest research and evidence on what we know works in public health, sharing knowledge, helping develop skills for integrating evidence, and supporting public health so that they can really be confident in the decisions that they make, because they know that those decisions are informed by the best available evidence. And I mean, our overall vision, our overall goal is that public health becomes stronger in Canada because it is driven by that best available evidence, and that results in improved health and well-being of every person that lives in Canada. So the presentation today is focusing on evidence-informed public health. So what do we actually mean by evidence-informed public health? What does this mean? What doesn't this mean? So specifically, this is the process of distilling and disseminating the best available evidence from research, from context, and experience, and using that evidence to inform and improve public health practice, programs, and policy. And if we boil that down to what that really means in a very simple term, it's using what we know works in public health. In terms of what evidence-informed public health isn't, so part of my job as a knowledge broker, I do a lot of outreach to different organizations, and one of the things that one of the things that I'll do is ask people about how are they using evidence currently, and we often hear things like, "Oh, right, we use evidence all the time." And when I dig a little bit deeper, what I often hear is things like, "Well, let's say we need to make a decision. We'll think of a program that works, and then we'll look for evidence on that program." And what we affectionately sometimes call this, opinion-based evidence making, where you've already really made the decision that you're going to be doing whatever program it was, and now you're finding evidence to support that. I'm sure most people are aware you can Google and find evidence to support pretty much everything at this point. So that is not a truly evidence-informed or evidence-based approach. We'll go into this in some more detail, but the truly evidence-based or evidence-informed model asks a question, finds and considers all of the evidence related to that topic or that question, and then brings all of that evidence together to make a decision. So you're not just looking for the evidence that supports a particular decision, but all of the evidence related to a topic, and then you can make your decision based on all of the evidence that you have found. When we integrate that best available research evidence and other types of evidence into the decision-making process, that is when we are using a truly evidence-informed decision-making process. Now, why would it be important to use evidence-informed decision-making, especially in public health? And I mean, there certainly are a number of different reasons. Number one, avoiding harms. There are some interventions that you may expect to be beneficial, but they're actually causing inadvertent harm to certain individuals or certain communities. A good example of this would be, I don't know if you remember, I think they were popular in the 80s and 90s, those Scared Straight programs where they took at-risk youth and had them meet with formerly or meet with individuals who were incarcerated in the prison system. And these individuals would try and scare those youth straight. So try and scare them off of criminal activity. And what they actually found after analyzing this was that the youth who had been exposed to these programs, who actually went through the Scared Straight program, were actually more likely to end up interacting with the justice system and eventually being incarcerated. So there was some inadvertent harm going on with those programs. So another example would be certain types of suicide prevention programs where you need to be very, very careful about how you talk about suicide so that it's not triggering for certain individuals and it doesn't actually inadvertently lead to a increase in attempts or completed suicides. Harm may also come from wasting resources. A lot of people know that in public health, our resources tend to be finite. We have a budget and we need to stay within that budget. So how can we maximize those resources and make sure that there aren't resources being wasted on interventions or on programs that don't actually work or don't get to the outcomes that we're wanting? So using the evidence-informed approach can help you improve outcomes, make sure that we are using using programs so that we can maximize what our outcomes are and improve outcomes for the greatest number of people. And also helps improve satisfaction. The public expect that we are using evidence. I find that if I explain what my job is, sometimes people are, are thinking, like in my family members, wait, aren't people doing this already? Why isn't this already happening? And I mean, of course, to some extent it is, but there is always improvement to be made. And the public really does expect that we are using evidence in order to make those decisions. We see this especially with criticisms of certain decisions related to the COVID-19 pandemic. Are certain decisions related to lockdown or restrictions? Are those actually based on evidence or scientific evidence, or what are these actually being based on? So, a number of different reasons why we promote evidence-informed decision making. So let's talk a little bit more about actually what is evidence. So when we're talking about evidence, what do we actually mean? So at the NCCMT, we emphasize that evidence is very broad. There are a number of different types of evidence that come into that broader category. So starting with our model, which is on the screen, if we start with the purple bubble on the lower left-hand side, we look at research evidence. So this would be the most relevant, high-quality, quantitative or qualitative evidence from a variety of disciplines and sectors relevant to public health. Sometimes that means taking things from the social sciences, from the medical sciences, but anything that falls under that published or sometimes unpublished research category goes into that sphere of evidence. Community health issues and local context is also very important. So this includes things like surveillance data, community health status reports. This type of evidence helps you determine the magnitude of a health issue in a local setting, and what is the significance and the importance of this issue in comparison to other concerns of the community. Community and political preferences and actions. These are the needs and interests of community members, the current political climate, the current organizational or corporate climate. So this can often inform what types of programs or interventions will actually be acceptable in a community. I know here from a local perspective, there was quite a bit of talk about safe injection sites where while the evidence was, overwhelming that these are positive and can help reduce harm, it was difficult to actually find sites to set these up because the community did not want those sites in their communities. So these are different things that do need to be taken into account. And then finally, resources. So financial resources, human resources, the materials that you need. Looking at your resources helps determine feasibility. So what do you actually have the resources to implement? I mean, maybe the very best, most effective program is not within your budget. So that will inform the decision that is made overall. And then all of the evidence from these 4 different spheres come together using your public health expertise in order to make a decision or a recommendation. It's important to note that this model is dynamic. In any given situation, one or more of the bubbles may exert more influence than the others. For example, if there's a political preference for something and you know that they're opposed to something that may be proposed in the research, you know that that's not going to fly. Or maybe you don't have the resources for something, or perhaps there you do have an intervention for one problem, but there's actually another problem that is of much greater importance to the community and to that local context. So in any situation, I sometimes picture the bubbles as being bigger or smaller for certain situations, and they each exert their own influence on that overall decision. So if we think of this model as kind of the what evidence goes into evidence-informed public health, our next model that I'll pull up is the how. So what process do you go through in order to find and use and apply the evidence that you have found? So we usually call these the 7 steps of evidence-informed decision-making. I will go through these in a bit more detail through the rest of the presentation, but very briefly, these steps help you address a particular issue by systematically incorporating evidence into that decision-making process, starting with defining your question, defining a specific question, doing an efficient and focused search, appraising the evidence that you have found during your search, appraising that for quality, synthesizing all of the evidence that you have found, usually weighing it by quality in order to make your recommendation, adapting that to your local context, and then developing and implementing an implementation and evaluation plan. These last 2 steps usually go hand in hand because you need to plan for evaluation as you plan for implementation. But evaluating what you have done, both in terms of the outcomes, the health outcomes that you've had, as well as evaluating how well you implemented. So what, how well did you implement the intervention as you should be? So how many times, did the intervention actually reach the community members that you're hoping to reach? And then once you've done your evaluation, that sometimes loops right back around to define. And that's why we have this set up as a wheel. So depending on the results of your evaluation, you may have further questions. Maybe you need to refine your question, or maybe you have another follow-up question in order to maximize your outcomes. So in terms of what this looks like during the COVID-19 pandemic, as Emily Belita mentioned during her introduction, there has been an absolute explosion of research articles. Different journals have been doing different things, like anything that's labeled as COVID research gets put to the top of the line so that it can get out and to decision makers and other researchers as fast as possible. The peer review process has been accelerated as well. There are new COVID-specific databases online where you can be looking for COVID-specific evidence. There's also the issue of preprint articles. So a preprint article has not yet undergone peer review. Normally when you're looking for evidence, I mean, you can often, ignore some of those non-peer reviewed articles, but when it comes to COVID, it's time is often a really, really important factor, and you want the most up-to-date evidence, and that most up-to-date evidence hasn't undergone peer review yet, so it hasn't been reviewed by experts, and what you're taking is kind of at face value. So how can you handle that? So what we would like to do with this presentation then is talk about, what have we learned from our response to the COVID-19 pandemic, and how have we applied that to the different steps of the evidence-informed public health model. So that's what I will be starting with now. If there are any questions about the models on their own, please make sure that you type those in. I'll see if I can get to those now. But what I will do now is discuss a little bit more about what we have done at the NCCMT in terms of our COVID-19 response. So typically what we've been focusing on is building capacity and doing training, providing online training in order to help people who work in public health find and use evidence. And what we found then at the very beginning of the COVID pandemic was everybody needs evidence now. We need high quality evidence. We need synthesized evidence. There wasn't time to do this training. It's either we already have these skills or we need to find somebody who has them. So we were particularly well suited to address this need. Our staff, the staff that we have are well trained in research methods. So we pivoted from teaching and capacity building and training to actually producing that evidence and synthesizing the evidence that was available on COVID-19. And we did this with two main responses. The number one is a rapid review repository that's on our website. So one of the things that was evident early on was that there were numerous organizations across Canada and worldwide doing rapid reviews of the evidence. So looking at what was out there on a particular topic, bringing all of that evidence together into a rapid review. But there was no coordination. So you could have had, groups in Alberta and in PEI and in Ontario, multiple groups working on the exact same question and looking at the exact same evidence. And while you do need to adapt a little bit to your context, the core studies that you would be looking at are the same. So in a time when, time is of the evidence, we only have so many people who can be doing this, let's do a better job of coordinating who's doing what. So we launched this database of rapid reviews. We focused mainly on Canada, but there are a number of international entries as well, where people who are working on rapid reviews could submit the questions that they were working on. So we have both ongoing and completed rapid reviews from across Canada and around the world. We have at least 200. I think we're maybe 220 or so now since launching this, I think, end of March, early April. So it's a really good place to look and see, are there rapid evidence reviews completed? Are there any ongoing? And this has helped facilitate some coordination of efforts and some synergies. And we've had a couple of researchers or people looking at reviews who have told us they found somebody else was already doing a review, so they stopped theirs and refocused their efforts on something else, which is really exciting for us to hear. And the other thing that we launched was our rapid evidence service. And this is where we actually, a team at the NCCMT, completes rapid reviews. So typically we take questions from people across Canada, people working in public health, people at the Public Health Agency of Canada, key decision makers. They can submit questions and we evaluate those questions on a weekly basis, see what we have the capacity. We are a small team. What do we have the capacity to complete? What do we have the expertise to complete? And we complete a rapid review in usually about 2 weeks, which was unheard of prior to the COVID pandemic. We used to say, oh yeah, it takes at least 4 to 6 months to complete a rapid review, and we had some, in 5 business days we were completing. So we managed to really optimize that process, and we had a dedicated team for this, and we've completed, I want to say about 26 different topics, rapid reviews, including some updates as new evidence has come out on some of those. So from both of these projects, what have we learned about applying evidence-informed public health in a world with COVID-19. And that's what I'm going to launch into now. So talking about the different steps of EIPH and then how they are, different than they were maybe a year ago, because we are living in a world with COVID-19 evidence. So the first step in the EIPH process is defining your research question. Research questions should be focused, they should be specific, and they should be actionable. It sounds like it would be a really intuitive and easy process to come up with what your research question is. I mean, you know what it is that you need some answers on, but we find that people often underestimate what is actually involved in coming up with a good focused, searchable research question. You do need to be specific so that you can be sure that the results that you find are going to be usable for your population. We do have a template for coming up with your research question. Research questions are often structured in a PICO or PECO format. P for population, I and E for intervention or exposure, C for your comparison, and O for outcomes. And going through a worksheet like this really helps you narrow down what it is that you're looking for, as well as what it is that you are not looking for. Are there specific subpopulations that you're interested in, particular settings that you are interested in, and whether or not you would be looking at other things as well. I mean, even looking at which outcomes you are interested in can make a big difference in terms of the evidence that you would actually then include in what you're looking at. So in terms of defining a focused research question during the COVID pandemic, a couple of different things that we have found was it's often important to determine, when are we looking? So if we want to look at best practices for something, let's say for screening at a hospital or something like that, you're going to find different answers from, the very early pandemic when maybe we didn't have infection and infection prevention and control measures in place. Or are you more interested in, what was happening during the near global lockdown? What was mental health looking like during that lockdown? What was food security looking like during that lockdown? Are you more interested in the second wave, when things started opening up a little bit more, what practices were implemented then, what were found to be effective and not effective? Second wave looks a lot different in terms of practices than the very, very early days of the pandemic. And where you're looking is also something that we found really, really important to define, because you want to make sure that what you find is going to be applicable to your context. So sometimes that's, whether you're looking in low middle income countries, or, for us, we're often looking for answers for the Canadian context. So which countries have had, rates of COVID similar to Canada and a COVID response similar to Canada as well. So all of these are things that we have found to be important when looking for COVID-related research or evidence. And then when it comes to actually looking for evidence, there's a lot. As I think Emily Belita said, there's about 23,000 articles already posted related to COVID-19, or maybe that was just in the first 6 months, I think, which is crazy. That's a lot to look through. So how can you start your search? How can you be optimizing your search? I mean, even in pre-COVID days, there's a ton of research literature out there. So how can you use your time the most wisely? If you're given, an hour or an afternoon to find something, where can you start your search and how can you optimize that to be the most efficient? So we often talk about then the 6S pyramid. And the 6S pyramid is a tool that gives you a hierarchy of research evidence, where the most synthesized evidence is at the top of the pyramid. So these are things like summaries or guidelines or systematic reviews. that take into account the findings of multiple single studies. I don't want to make any assumptions that everybody knows what a systematic review is. A systematic review is a very high level of synthesized evidence on a given topic. It's conducted using systematic, transparent methods. It's supposed to be where, you know, if somebody else were to take your methods and do the exact same methods that you're reporting, they should be able to find the exact same research studies and the exact same findings that you did. So it should be really rigorous in terms of, you know, how systematically and how transparent it's been done. So the systematic review then takes the findings from multiple single studies and brings that all together in some kind of synthesized finding. So that can be done either narratively, where the author would discuss what was found across multiple studies. It can also be done through a meta-analysis. A meta-analysis is where you actually combine the results of multiple studies. So what I've posted on the screen is absolutely made up and oversimplified, but let's say you were to take 3 small studies for a given intervention, each of them with maybe 1, 3, or 500 different participants. And these studies were too small to actually see an effect of your intervention. What a systematic review and meta-analysis may do is treat those 3 groups of study participants as if they were part of one bigger mega study where you have, you know, over 1,000 participants, and then pools all of the participants' results together, and maybe then it's actually there are enough people so that you can actually see an effect of that intervention. So a systematic review with or without a meta-analysis can be a very, very powerful tool, because the authors of that review have taken that evidence, those single studies, and actually already taken those and combined them to give you a more robust answer based on more than one single study. So looking again at the 6S pyramid, I would be starting my search at the very top of the pyramid. So starting with summaries, these are my guidelines. So this was an example I did a couple of months, or actually before COVID now, so a few months before COVID. So a search for something like built environment and mental health. I mean, I could look at, you know, let's say I wanted to look at the single studies, and I start with a Google search, which I know lots of people like to start with. A Google search is going to give me over 4 million results, which is way too many to get through. Even Google Scholar gives me over 60,000 results. PubMed, so a database of published research literature, 194, not so bad, but still it's close to 200 studies that you have to read through and sift through. So instead of looking at those single studies, why don't I look at syntheses? So these are our systematic reviews with or without meta-analyses. And the health evidence database, looking for built environment and mental health, has 34 systematic reviews. And the theory is that those 34 systematic reviews probably include most of those 194 studies that are in PubMed, and probably a number of the ones that are in, you know, that came up in Google search, or has at least, you know, excluded those. And if I want to look at the next level up, which would be our summaries, which are also known as guidelines or clinical practice guidelines, the TRIP database returns 3 for the Canadian context. So if I'm going to be starting my search on this, I'm going to start with the guidelines or the summaries, start with looking at those 3. I can pretty quickly get through those 3 and see, are these answering the question that I have? If not, I'll move down the pyramid, down to the systematic reviews or syntheses, and look at those 34. Is there one that is recent and high quality that answers my specific question? And if not, only then am I going to start sifting through those almost 200 results in PubMed. So this is a way to really streamline your search. If you find something at one of the higher levels of evidence, let's say a clinical guideline or a systematic review, you can stop. You don't need to be looking at those single studies, because those will already have been taken into account in those systematic reviews. Yes, TRIP is tripdatabase.com. In terms of looking for systematic reviews, one really fantastic resource is the Health Evidence Repository. So this is, I think we're actually over 6,000 now. I need to update the slide. I believe it's over 6,000 quality rated systematic reviews that are specific for the specifically evaluating the effectiveness of public health interventions. So if you have a question on an intervention for public health, this is a really great place to get started. You can do searching with different filters. You can type in keywords, or you can use different searches for topic area, population, the different types of intervention strategies, and it will provide you with the latest research first, so the most recent evidence first, and the quality rating for those. We have a team at Health Evidence that screens the research literature on a monthly basis. We pull from 5 of the major databases. And screen through those, usually about 7,000 or 8,000 results a month. And then the ones that are included, because they are public health interventions, we do in duplicate a quality rating of those. So actually seeing how strong is the systematic review, does it really get all of the evidence on a topic? Does it combine that evidence, does it combine the findings of those studies in an appropriate way? So do they come up with valid findings? So when you're doing a search in the Health Evidence Repository, you can be confident that if you find something that is recent and high quality, you can feel pretty confident in what you have there. The Health Evidence also runs an evidence service. So if you sign up at the database, it will ask you what public health topics you're interested in. And every month it sends you a list of studies added within those topic areas. It'll also provide you with the quality rating of those studies. So it's a really great way to stay up to date with the topics that you're interested in without having to be looking at those individual databases yourself. And keep in mind, this is synthesized evidence. This is not those single studies. These are reviews that have looked at all of the single studies together. In terms of looking for evidence for COVID, I mentioned earlier that there are a number of databases that have been developed specifically for COVID-19 evidence. Again, I recommend looking for synthesized evidence when you can over the single studies. A couple of these databases, you'll see they include both synthesized and single studies, so you can do a search more specifically for reviews. So there's some that I've listed in both places, but Lit COVID is the PubMed COVID-19 database. So this pulls all of the COVID tagged research from the PubMed database. The World Health Organization has a database with evidence. LOVE is a systematic review specific database of COVID-19 evidence. It's run through the Epistemonikos group, and they actually use artificial intelligence to come up with the different, what studies go where, and they have a really fantastic database there that you can take a look at. The Oxford group through Uncover are doing COVID-19 rapid reviews, as are the NCCMT and the McMaster Health Forum. I've started the ones that are not necessarily all peer-reviewed. So, the Oxford group, NCCMT, we're not going through that formal peer review process. Some of what the WHO has published is also not undergoing a formal peer review process. So that would be something that, so critical appraisal will be very, very important for you to do. And in terms of single studies, you can take a look again at Lit COVID, at the World Health Organization database. The CDC has so the Centers for Disease Control has their morbidity and mortality weekly reports, where you can find summaries of evidence for transmission of COVID in different contexts. And as I mentioned before, there's a lot of preprint publications coming out. So where evidence hasn't necessarily gone through peer review, but it's been submitted for publication. And then before that's printed in a publication, it's indexed on medRxiv is how you pronounce that. So that's the preprint server where you can look at, really what is the absolute latest evidence that you can find on a given topic. So again, I caution the ones that are not peer reviewed. You do need to take some of those findings with a grain of salt. Know that there isn't a content expert who has, verified what the authors have put through those already. But they can be very, very powerful. I know that when you're reading headlines, when you're reading news reports, there's often, on a given week, you'll find there's one study published that has everybody up in arms. And I remember right before Halloween, there was a study that came out about, I think, the virus living on surfaces for up to 21 days or something. So, my family's sending me this and saying, oh my goodness, right before Halloween, it's on surfaces, we can't pick up candy. And I said, okay, let's take a look at what the synthesized evidence says. Let's look at all of the different studies that look at virus survival and, so you can get a more balanced response, or at least one that has been, kind of validated by other people who have been looking at the same thing. And so able to kind of temper some of those sensationalized headlines a little bit. So looking at your synthesized evidence is going to be a way that you can feel more confident in what you have found. And the databases on the screen are a couple of places that you can start with. So the next step in the wheel, once you have found your evidence, is appraising it for quality. Now, this is something that is important all the time, not just during COVID times, but it's looking at the research evidence or the evidence that you have found and determining how confident can you be in the findings. So, reading the conclusions by the authors, their recommendations, how confident are you in those recommendations? There are a number of different tools available in order to guide you through the critical appraisal process. We list here for guidelines the Agree To tool. For systematic reviews, the Health Evidence Quality Appraisal tool. It's the one that we use to actually come up with the ratings on the Health Evidence website. And it's one that has a bit more of a public health lens on it, so it can be a bit easier to use when you are working in a public health context. And then the Critical Appraisal Skills Program, or CASP program, they have a number of checklists that were actually designed for teaching critical appraisal for different study designs as well. They have one for systematic reviews as well as for a number of the different single study designs as well. So in terms of learning how to do critical appraisal so that you can be really confident in the research findings that you have, we do have a number of online learning modules. 4 of our online learning modules are dedicated specifically to critical appraisal. They're all interactive, they're problem-based. So for each of these, they give you an overview of the process, an overview of, why and what you're looking for. And then they give you a public health scenario. So we tried to keep this as realistic as possible. They give you a scenario, they give you an article, and they walk you through the critical appraisal. So for each of the different questions, it says, what you should be looking for. It asks you to take a look at the article, come up with your answer, and then it provides you with a sample answer and a discussion of how we came to that answer. So they're very much guided critical appraisals. It's probably the next best thing as opposed to doing a live one with an expert, because we've really written it so that you do get that experience yourself, and then you do get the verification or validation by an expert who's written those. Probably the most applicable now during the pandemic would be the one for intervention studies. That's a good one to get started with if you're looking at single studies, as well as the critical appraisal of systematic reviews. So if you are trying to look for synthesized evidence, again, so you don't have to sift through those single studies, this is a really great one to get your head around, what should you be looking for in a systematic review so that you have one that you can be confident in those findings. Again, I really do want to emphasize that it is very, very important, especially during the COVID-19 pandemic, to be doing that critical appraisal. So one thing that we noticed is that there are a number of groups doing rapid reviews or systematic reviews during the COVID pandemic, and they're saying, you know, for the benefit of time, in order to get a timely answer, they're skipping the critical appraisal step. And at the NCCMT, we feel very, very strongly that that's not something that is a valid way of doing that. We feel that the critical appraisal is more important than necessarily the expedience of getting a quicker answer. Again, with that really big explosion of research literature, it's coming in all shapes and forms. So much of it has not been peer reviewed. So much of it is still in those preprint databases and hasn't necessarily been gone through peer review by a methods expert or a content expert. And if you're going to be making these critical decisions about how to keep people safe during the COVID-19 pandemic, we really feel that you need to know how strong the evidence is that you're looking at in order to make those recommendations. So then next, once you have your evidence and you've appraised it for quality, it's time to bring it all together. So the synthesis step is really critical for communicating your findings. And there's a couple of different ways that you can communicate this, some more formal than others. We have a couple of different guides. One is the briefing note template. So this is a template that you can find on the Health Evidence website. We've just posted the link in the chat window. And this gives you a structure for presenting, you know, what you found, what you were looking for, what was the problem that you were looking for an answer to, in a way that a decision maker can get, you know, key findings in a very brief format. I mean, one of the things that we've learned in our doing rapid reviews is that those decision makers, they often are short on time. They don't necessarily have time to be going through a very, very long, thorough, a very long, in-depth discussion of what evidence was found. So bringing it together in a brief way can be very, very effective in getting that information to a decision maker. We also have a rapid review guidebook. This is a guidebook that we developed pre-COVID. And it takes you through all the steps of doing a rapid evidence review. So rapid review is not quite as extensive as a systematic review. It's faster than a systematic review. There are a couple of different ways that you can speed up the process without compromising rigor or compromising rigor in a very calculated and thought out way. So the guidebook will talk you through that process and give you places where you can try and save some time and still maintain rigor and quality. This is the guidebook and the process that we used when we started doing our rapid reviews in response to the COVID-19 pandemic. We are working on putting something together to describe our methods specifically for COVID-19, like which databases we search now, and you know, how have we done synthesis of findings. But this is a really great one to start with. One of the things that, one of the tools that I find especially important when you are trying to bring together those research findings and communicate that to somebody else is being able to explain the findings. Sometimes those findings are communicated through statistics. I'm not a huge fan of statistics. I find that I will learn enough for a course or for a paper and then promptly forget a lot of it. So we have a series of videos called the Understanding Research Evidence video series. And these are short 5 to 7 minute videos that go over different topics in a way that's really easy to understand. We've got like cartoon videos that take you through them. And what these do is both help you understand as well as communicate your findings. I know that for myself, sometimes I find that, you know, even though I do understand what it is that I'm reading, I'm not necessarily able to communicate that to somebody else who may not be as familiar. So these videos help give you the language that you need in order to communicate this to somebody else. In terms of bringing findings together, it's important that once you've done your critical appraisal of the different pieces of evidence, you include that quality in the summary of findings. So when you are saying, it was found that let's say smoking rates increased by X during the COVID-19 pandemic. How confident are you in that finding? Is that based on high, medium, or low quality evidence? Because that should affect the final decision that is being made. It's important to also present the limitations of the evidence that you have found. What are the gaps in the knowledge? Especially with COVID, it's we've only had so much time to work on this topic, and I mean, what's covered is often important, but what's not covered by the evidence is also very important as well. The approach that we have taken during our rapid reviews is actually using GRADE. GRADE is a framework. It stands for Grading of Recommendations, Assessment, Development, and Evaluation. And what that really is a formal way of taking like individual pieces of evidence, individual findings, their quality, and then bringing those together to a final key findings summary that is now weighted by that evidence. The way that one of the ways that the GRADE approach then presents things is, in terms of how likely are these findings to change with more evidence. So they take into account both the research design as well as the quality within that design. And then in the end, you end up with a finding that you can say this is based on, let's say, low quality evidence. It's likely to change as we get more as we get more evidence on this topic. Or perhaps maybe you have something that's really strong, and you can say, we have this recommendation. This is based on strong evidence and is unlikely to change as more evidence comes out. So what I've included here is an example of these. So this is our rapid review on risk communication. So we did a rapid review on what are the best practices for risk communications and strategies to mitigate risk behavior. I mean, effective communication is absolutely critical for leaders during the COVID-19 response. And if you keep up with the news, I mean, some jurisdictions are doing a better job than others. And what is it that makes some people more successful? Why is it that some countries have been able to communicate so well with their public and some have not been able to establish that trust? So how can we best communicate with the public? So the way that we then structured our findings, so after going through the entire rapid review process, defining our question, doing the search, appraising the evidence, we synthesized then our findings using the GRADE approach and presented them with the quality statement with it as well. So for example, the first key point was that messaging should be clear, repeated, action-oriented, and by a trusted leader. The certainty of this evidence was moderate. The second point was about how trust can be built. And based on the evidence, the certainty of that evidence was low, and it may change as more data becomes available. So you can see the difference between the two, where one, we're fairly confident in the findings, and the second one's, well, we're actually have a little bit less certainty based on the evidence that is available. And that's because the individual pieces of evidence, let's say we're looking at single studies or we're looking at just different systematic reviews, the quality of those is a little bit lower. So we can't be quite as confident in the findings that they find. And then we're not as confident that this finding will stand as more data, more evidence becomes available. We also make sure that in all of these, we provide an overview of the evidence. So for example, for this one, the majority of the evidence is non-COVID literature. These studies take time, and they really haven't come out yet for the COVID-19 pandemic. So for example, the evidence that we found were from previous epidemics, risk communication about vaccinations, about smoking, and some of them are a little bit older, and way that we communicate and the way public health leaders communicate has changed, and these may be less relevant now that social media is driving so much of this communication. So that is a gap in what we have, or a limitation in some of the findings that we have. The studies that we do have on COVID-19 specific messaging was so far limited to analyzing how information spreads via social media. So all of the stuff that we have specific to COVID-19 really only looked at how this information is passed along in those social media challenges or channels. So it's a little bit less about what the way that leaders should be communicating, and more about the spread of that. And also, I mean, in the first point that we looked at on the last slide, it's mentioned that things should be coming from a trusted leader, but the literature that we found didn't necessarily define what a trusted leader is, or what are their characteristics, what makes someone a trusted leader in the community. So I wanted to provide this example with this rapid review that we did on risk communication to show you how everything really kind of comes together when you're looking at evidence for COVID-19, or for other topics as well, where once you've done once you've developed your question and done your search and critically appraised everything, how you can bring things together in a way that is then balanced by the quality of your evidence, as well as what your evidence may actually be missing. So all of this gives context to your decision makers, to your policymakers, so that they can then know how confident they can be in those findings, and how they can use that to inform overall decisions. So we focus mostly on the first 4 steps in the evidence-informed decision-making process. For the additional steps, so the steps adapt, implement, and evaluate, there are a number of tools available through the Registry of Methods and Tools. This is a database that is available on the NCCMT website. It's a searchable database. You can do a keyword search. You can search by different filters. And there are summaries and links for over 200, or I think we actually did, we got rid of some older ones, but I think almost 200 resources categorized by whether it's a method or a tool, what type of knowledge translation, KT is knowledge translation or activity, and which step in the EIPH wheel do they address. So I think a screenshot on the next slide here. So you can let's say if you're interested in tools that can help you with implementation, you can click off those check marks, and there will be supports for those. The tools that come up and the methods and tools that come up in this database are not necessarily from the NCCMT. We have gathered these and curated them based on methods and tools that have been developed by experts around the world. But we've indexed them here with descriptions, what you can use them for, how they were developed, and links to those resources. So it's a really great place to look if you have a challenge and there's something that you need to accomplish. There's a good chance that somebody's already encountered that problem and come up with something that will help you with that. You can explore our rapid reviews online. So the Rapid Evidence Service is available at the link on the screen, which I think will get posted in the chat window. We are at 26 reviews and it's growing. We're working on one right now on transmission of COVID-19 in acute care settings. We're looking to update our ones on long-term care facilities, on the role of children in transmitting COVID-19, and on food security and how food security has been impacted by the COVID-19 pandemic. So the list is growing. And some of the really priority topics, they do get updated fairly frequently. So the COVID-19 evidence is constantly growing, and things become out of date shockingly quickly. So we are making sure that some of those key issues are being updated as we're able to do it. One of the things you can do on that webpage is sign up for email alerts. Simply enter your email address, and then anytime we add a new one or update an existing one, you'll get an email with a link to that so that you can stay on top of these. We're interested in receiving priority questions. If you have a priority public health question that is needed, where you need an answer for a decision that will impact your community or wider, we do accept suggestions. Our email address is, it'll be on the last slide, but nccmt@mcmaster.ca, and we do accept suggestions for those. And as I mentioned earlier, on a roughly weekly basis, we go through and assess, what do we have the capacity to do, and what are topics that we feel really will resonate with decision makers and are really urgent for decision making. In terms of getting started with evidence-informed public health and the skills that you need in order to do evidence-informed public health, we have a really great learning needs assessment tool. It's called the Skills Assessment Tool. What it is a set of 20 multiple choice questions. You can complete these questions. They're all multiple choice, and you're encouraged not to guess. If you don't know something, you're encouraged to say you don't know, because at the very end, you get a personalized report where for every question that you had the wrong answer or you didn't know an answer, it will provide you with resources that you can access in order to improve your skill in those areas. So it really is a learning needs assessment where it identifies the gaps in your knowledge and skill and then gives you resources in order to help fill those gaps. So a couple of ways to really get started. You can connect with us, sign up for our newsletter. We're on Twitter, we're on Facebook. Check out some of the rapid reviews that we've completed. You can sign up for the email alerts. Try the skills assessment and see how much do you remember from school in terms of statistics or interpretation of research findings. See where your gaps are and what some of the resources that you could access to improve those skills are. Our online learning modules are free. They're available online. The critical appraisal ones, as I mentioned, are really fantastic hands-on guided tours of critical appraisal and talk you through all the things that you really should be looking at when you're reading a research article in terms of how confident can you be in those overall findings. And last but not least, check out a relevant topic, something in your field on health evidence. See what the latest synthesized evidence is. See if there's anything that's really high quality. See what kind of answers are out there. It's a really great place to get an idea of what the status of evidence is in a certain topic. So those are all the resources that I wanted to share today. I hope I've done a good job of going over the process as well as how the process has changed or been adapted, not necessarily changed, but adapted to and incorporated this new evidence climate. Now that we have all this evidence related to COVID-19 coming out quickly and not necessarily undergoing that peer review. So I'm going to open it up now for questions. Very excited to hear what kind of questions you still have, or if you have any questions about the process, about any of the resources that we talked about, please feel free to put them in the chat now. I know Emily Belita, I think you were keeping an eye on the chat. I don't think there's any questions that have gone unanswered at this point in the chat. So we'll make sure we give you a few minutes to be typing in case you are typing out some questions. Any reviews about COVID-19 in conflict zones? We have not conducted any reviews for these. We do tend to focus on the Canadian context. That's not to say it's not an important issue, but with our funding for within Canada, we did look at, I think we did at one point consider one on refugee status, but those would be for refugees that have now integrated within Canada. I think that is a very interesting topic, and I'd be happy to point to, if you reach out via email, we could point you to probably some of the evidence that does exist on those topics, on that topic. So while we're waiting and seeing if any more questions come on in, we'll take a minute now to encourage you to share your story. We are always interested in hearing about, how EIDM is impacting your practice, how it's being used. You can feel free to email us. If you need support, you can contact us for help. Our email address is nccmt@mcmaster.ca. I see a question in the chat box about where review requests can be submitted. It's the same email address, nccmt@mcmaster.ca. We're usually pretty good about getting back to you within about 24 business hours, sometimes 2 days, depending on how busy we are with reviews, but usually pretty quickly, so we can help you move on with whatever project it is that you're working on. But really don't hesitate to get in touch with us about support for any of the steps. It's a lot to take in. There's a lot to look at and a lot to wrap your brain around. So if you do need some support, please reach out and we can point you in the right direction. We'll take a second now for some feedback. I believe this will come up as another polling question. So we're asking about, how you found this webinar in terms of understanding or increasing your knowledge and understanding of evidence-informed decision-making. So we're interested in how effectively we've done that. So some really nice responses coming in there. Most people do agree that this has helped your understanding of evidence-informed decision-making and hopefully some of the resources that will support you as you learn more about this. I mean, there's only so much we can do in a 90-minute webinar, and there's a lot out there. So, I mean, this was intended to give you a bit of an overview and point you to some of the tools that you can use in order to increase your understanding. And our next question is whether or not this information will be useful in your own practice. So whether it's some of the EIDM model, the different steps for EIDM, or some of the COVID-19 information. So, different things to consider when you're searching for evidence, some of the databases to look at, how to bring evidence together for decision makers, some of the information on how to access different synthesized evidence. We're seeing most people are going to be using this information, and that's really, really great to see. We're very, very pleased to see that. Our next question is about, how you found this webinar. So whether it was relevant, whether facilitation was effective, opportunities for participation, whether it was easy to follow, if it met your expectations. So please check off whichever statements you do agree with and hit submit. We do use this information to improve and adapt our processes to make sure that we really are meeting the needs of the audience. We really want to make sure that these, everybody's busy. So if you're going to spend, an hour or more in a webinar, we want to make sure that you're getting the most out of it as possible. So we do collect this data and use it and look for areas for improvement as well. So it looks like most responses have come in, and that's fantastic. Oh, and a few more trickling in. Thank you. And I think we have, I'll give it another second. Yeah, very last question is, can we contact you? So you're registered with your email address. Everything is kept anonymous, but if you do check that we can contact you, we would be able to get in touch with you that way. If there are any concerns or anything like that, we can reach out to you as well to follow up. So thank you so much for that. And then our webinars. We aren't running as many as we usually are, as we're focusing our efforts on our COVID-19 response. We do have a couple in the works for January, so a couple that are coming out in the new year. Take a look at our webinars page, and it'll direct you to our webinars channel, where you can see when things are coming out. Everything will be posted there, as well as if you sign up for our newsletter, that's where we announce any upcoming webinars there as well. A lot of our webinars, this one was more internal. We had a presenter from the NCCMT, but we often invite, content experts or some of the authors of the methods and tools to present things as well. So you can hear directly from the authors about certain resources. I see 2 questions about proof of attendance of a webinar. Yes, so you can email us and we'll get that back to you as well. I think we have a standard template for that. I see a question about guidelines for rapid reviews. I mean, one place to look would be the Rapid Review Guidebook from the NCCMT. This takes you through the process. And I would say a number of the resources. So one of the leaders globally about in terms of rapid reviews is Andrea Trico. I'm going to put her name in the chat window so that you don't have to worry about spelling it. She has a number of papers on rapid reviews, and they go through the different processes as well as some of the standards and what should and shouldn't be done by a rapid review. So she's a really fantastic resource there. And if you do a search for her name and rapid review, you should be finding some good resources there. But in terms of doing one specifically for public health, our Rapid Review Guidebook is a really great place to start too. We've written that specifically for a kind of a beginner public health audience. And that's great. We're getting close to wrapping up. We're actually on time for once, which is really exciting. If anybody does have any more questions, please feel free to send us a message through our email, nccmt@mcmaster.ca. You can check out our website. All our contact information is there as well. I certainly hope that this webinar is helpful to you, helps you wrap your brain a little bit about how to take an evidence-informed approach in a COVID-19 world. I do wish everyone here I hope you have a safe and happy rest of the afternoon, rest of the month, rest of 2020. Stay safe and, wear your mask. Happy to hear from all of you via email, and I wish everybody a really fantastic holidays at the end of the year. Thanks so much to everybody, and take care.
Emily?
Yes.
Hi, I just wanted to take this opportunity on behalf of CHNIG to thank you for a really stellar presentation. I've seen this presentation done a few times. This obviously is the first time that it's done with a COVID-19 lens. And what I appreciate most about these presentations is the presentation of really practical tools that can be used in the EIDM process. I know there's such breadth in terms of the tools, and you can probably talk about this for forever, but I think you did a really great overview of providing a snapshot of the available tools through NCCMT that can be used not just in the context of COVID-19, but in answering other questions that may come up in public health practice. So thank you so much for your time, Emily. We really appreciate it. And also thank you, Banda, as well, for providing technical support.
Wonderful. Thank you so much. And thank you to CHNIG for the invitation to present.
Take care, everyone.
Take care.